Funding for this program is provided in part by the Minnesota Arts and Cultural Heritage Fund and the citizens of Minnesota.
Maybe mom and dad were right when they told me this wouldn't be nothing. Maybe I should take their advice, go get a life, or maybe get a job or something.
Coming to you from 125 Live.
Back home, tell everybody I was bluffing.
Our town.
Maybe I'll just get out my head and focus on what I know's coming.
This past weekend, Olmsted County reached a level of substantial community transmission of COVID-19. Here to tell us what this means and the new recommendations to prevent further spread is Director of Public Health of Olmsted County Health Services, Graham Briggs. Welcome to our town, Graham.
Thanks for having me, Nicole. It's great to be back.
So you're back here soon with us. We're learning with this virus to stay on our toes. Just at the start of the summer, things were opening up. People were feeling pretty confident in their vaccinations. The county was feeling pretty confident. Fast forward to now, we're having a very different conversation. And I wanted to start by you telling just a little bit about what it means for the county to have reached a substantial level of community transmission this past weekend.
Right, I think the CDC released updated guidance within the last week or so that goes down to the county level and provides some advice on how local jurisdictions can really understand what's going on as this Delta variant moves through the country. And so when this was first published, we saw that Minnesota and Olmsted County are fairly low compared to a lot of places in the country right now. But we, like a lot of other, basically everywhere in the country, have seen a turn upwards as this Delta variant moves through the population. And so while our rates are still lower than they were for almost all of the pandemic, according to the CDC guidance, we're getting to a point where there is some substantial risk now in the population if you go out and go into public settings and things like that. So what that really means then in just, common conversational terms is that there's probably some virus out there when you go out now, if you go grocery shopping or to a restaurant. And so it's warranted then to think about vaccine if you haven't been vaccinated yet, rethinking that. And if you're going out, putting a mask back on when you're in public spaces again to protect those that are around you, just in case you may be potentially spreading virus. I think the kind of curveball that we got with this Delta variant is that we're seeing it mutate a little bit around the vaccine now, for lack of a better term. So we can see the vaccines are still really, really effective at preventing hospitalizations and deaths in people, but we're now starting to see that people that are fully vaccinated might be able to still carry this virus around a little bit after they're exposed. And it does look more and more convincing in the data that we're looking at that people that, some percentage of people that have been vaccinated and get exposed to the Delta variant then can spread that on to other individuals. And so that's why we go back to this mask use policy when you've got substantial transmission in the community.
Okay. So you mentioned the Delta variant is sort of mutating a little bit around the vaccine. So is this what we're calling or we're seeing as a breakthrough infection, or is that something different?
Yeah, breakthrough infection really just refers to somebody who's been fully vaccinated. And even with that vaccine on board, the virus breaks through that protection and causes either a subclinical infection, meaning you get infected, but you don't even know you are because you don't really have symptoms, or you get some sort of infection associated with the virus, even though you're vaccinated. And we know that happens with all vaccines. Measles, mumps, rubella vaccine, the MMR, for example, is a really great vaccine. With 2 doses, it's about 97% effective at preventing you from getting measles. But that still means 3 out of every 100 people could get some mild symptoms or a breakthrough infection. So we see that same thing with COVID vaccine here, that even though the vaccine is working very well, we're starting to see a little bit higher percentage of the virus breaking through some of that immunity. Luckily, what we're seeing though with this Delta variant in particular is that the vaccine is still very protective against that severe disease. So Another way to say that is we're seeing a cold become a cold. This is just a cold virus, but it's new to us. So we've got to jumpstart our immunity from zero, get to the point that we recognize this. And as we build a little bit of immunity, there's going to be a Lambda variant and a Zeta variant and things like that, probably over the coming years. And so as we're building up some cross protection, meaning we get exposed to one variant and another variant, we get to a point then where it's pretty easy for our immune system to tweak itself a little bit, and maybe you get a cold, 99-degree temp for a day or two, maybe a little cough, maybe you feel a little bit under the weather. That's what almost everybody that has symptoms associated with a stealth infection but has been vaccinated is getting. And so that's actually not terribly surprising. I think we would have preferred not to have to deal with this or put masks back on, but really, it's not terribly surprising that we're seeing a cold virus mutate a little bit and adjust to the defenses that we're putting up against it.
Well, thank you, Graham. We will be right back to continue our discussion of the state of the pandemic in the county and measures the county hopes will prevent further infection in the weeks and months to come. Be sure to stick around. Be sure to stick around. We have much more coming your way on Our Town. The Rochester Community Band performs a parking lot concert, and Graham Briggs stays around to continue the discussion on COVID-19. But up first, we hear from the crew at Family Promise Rochester in this week's Our Culture segment.
Family Promise National started in New Jersey. It was by a woman who saw a need for this service in her community. And so she piloted her own program called Interfaith Hospitality Network, where she included different church members and churches to provide that shelter. And then Family Promise kind of grew out of the need to provide services to those individuals. Shelter was a basic need that needed to be met, but then offering supportive services prolonged those individuals into more of a sustainable environment, essentially. And so now Family Promise has grown to over 200 affiliates across the nation. And so Family Promise Rochester is just one of those affiliates. Our mission is to help families experiencing homelessness and low-income families achieve sustainable independence through a community-based response.
We do that by providing shelter, case management services, life skills classes, etc., to families in the Rochester area who are experiencing homelessness. In February of 2021, we opened the doors to a static site shelter. We call it our North Star House, and we have the ability to shelter up to 5 families, or we think 18 people, though we are operating at half capacity during COVID. We currently have 11 people in shelter, 2 families.
Prior to coming into Family Promise and moving to Minnesota, my family, we were homeless for about 2-3 years, where we lived in a hotel, and it was a struggle doing it all by ourselves. And coming into Family Promise and knowing that they had our back, just being all around supportive of the families that came through the program, it helped to keep us from feeling like we were all over the place and that we didn't have anyone. We had a support system. We had somebody that was there to help us whenever we needed. It meant a lot. It still does. The life skills classes brought everybody together, and we got to talk about our experiences.
We have a large number of families that enter our shelter program, and many of them do come from out of the country. But each family that enters meets with our staff. These stories help us better understand their needs, where they're coming from, how to structure their individualized plans, and ultimately help them integrate into a new community. And this has led us to understand how they feel about our services that they receive from our staff and our volunteers, helps us understand what their expectations and needs are. For example, we recently created a meal exchange program that is culturally relevant, and it provides us the opportunity for cultural exchange between our program participants and our volunteers who are providing meals.
We are also piloting a new program where we're offering a little bit more of what's called shelter diversion. So trying to divert those families that are at risk of experiencing homelessness and trying to keep them in the place that they're at, just to kind of avoid the trauma of shelter if possible.
We know that racism is the reason why the majority of those people we serve are people of color. And we also know that we still have a lot of work to do to make that truth more visible and to change that reality. So we strive to do better at committing ourselves to addressing the racism that's robbing many children of their housing, their opportunities, their futures. And that's also why we are working hard to expand the diversity of our staff, our volunteers, our board. We are beginning to recognize that having diversity and the wide range of perspectives that brings are critical to helping us carry out our mission in the most compassionate way possible.
It's a really awesome program. The support system, they help lay a foundation for those who are in the program coming in, struggling to get on their own 2 feet. They work tirelessly for these families. And I can say that firsthand, that they did whatever they needed to do to make sure that we were okay. It's an awesome program. I love Family Promise. I do.
For more information about this story and other Our Town features, connect with us on Facebook, Twitter at KSMQ #OurTown, or ksmq.org/OurTown.
I'm Danielle Teal, and this is the Our Town Spotlight, a segment we like to dedicate to spotlighting businesses and organizations in Rochester. With us today is April Dahl from Dahl Dance. Welcome, April.
Thank you.
We're excited to have you here. Share a little bit more about your organization.
Dahl Dance, we're a ballroom dance studio, so we teach social dancing, anything that you could do in partnership. We work with a lot of wedding couples. We do some charity dancing here in town where we get celebrities to learn in 10 weeks and strut their skills.
I've definitely seen that. And during the pandemic, you brought up the social aspect, and the connection is so important right now. Of course, the dance community provides that. In what ways have you seen that benefit our community?
Just coming back here from COVID, although we're in transition, I know with the variant a little bit, people are really lonely. I mean, that was just heartbreaking to lose that connection. I know there are students I have that I'm the only person that hugs them all week. And so to be able to bring people back together safely has been really important for us.
I was there one time for a walkabout, I don't know if you remember that, and learned some moves. And ballroom dancing is a little bit more integrated and complex than people think. You know, what are some techniques that you tell people initially right when they're starting to learn to dance?
We really talk about touch. So, you know, you talk about a great handshake. You know, you're not the dead fish, but you're not breaking someone's bones. And safe touch, that anytime you touch someone anywhere on their body, you're communicating with them. And you need to be really aware of that. So it's being mindful of your interactions physically with other people.
What is Dahl offering with some of the events in the future, and how are you accommodating that variable that you might see a surge again?
We're kind of waiting like everyone else. We do have group classes online. We do ask that you be vaccinated when you're coming to events.
Oh, I didn't know you had group classes online.
Yes.
That's awesome.
Yep. And then we also are planning an event here at the end of August with a local dancer, Joel Torgerson from Pine Island, who's a pro, and we're doing a vaccine-only West Coast Swing Day. So it's a full day of activities for people to come to. You can register for that online. It's a great way to meet new dancers. We're seeing a lot of new people step into the community now.
And where can people find information about all of this?
On the website, dahldance.com, or Facebook. We're out there.
Awesome. What is one parting, positive, inspiring comment that you'd like to make that surrounds dance as a whole?
I just think in general, be aware of people and don't forget to engage. You know, sometimes a handshake or just saying hi or making sure that you validate a person when you're passing them in the hallway is really important.
Awesome. Thank you so much, April.
You're welcome.
Hi, this is Michael Wojak with your Our Town Rundown. You may have seen the signs or heard the news that Rochester is getting a new default speed limit at 25 miles per hour. While this is not going to be popular with some, there's some good reasons for it. First and foremost, it makes all of the people on our roads much safer. Not only does it decrease the severity of crashes that occur, but it decreases the frequency. And one of the things that's really surprising to folks is if you lower the speed limit and you don't make any change to the enforcement, the typical speed will actually reduce even in those circumstances. So do be aware of the changes and know that it's being done to make us safer, especially for all users in the community. Sidewalk Sessions is a 1 hour midweek opportunity to listen to some music downtown. The next one coming up is going to be Friday at 1 p.m. But if you take a look at the link below, you'll be able to see a number of other opportunities. Rochester Civic Music's Global Music Sessions are coming up again this weekend. This will be an opportunity for some adult and youth enrichment dealing with Tex-Mex music right here out of Minnesota. We're not necessarily known for Tex-Mex, but it's an opportunity to try something new. 2 p.m. on Sunday, and every Sunday from now until September 26th, there's an opportunity to take free salsa lessons in Central Park downtown. Or another opportunity coming up downtown, if you're more similarly coordinated to myself, is there's pop-up chess on the Peace Plaza, and that's going to be every Tuesday from August 10th to September 28th from 11:30 a.m. till 1:30 p.m. Finally, if you have kids who love butterflies, there's going to be an opportunity to visit a butterfly festival Saturday at Silver Lake Park East Shelter from 11 to 1 p.m. That is another free event, and that's just a little bit of what's going on in Rochester.
I'm taking all my days off.
Hi, it's Danielle Teal with Our Town Walkabout. I'm at the parking lot at 125 Live, and the Rochester Community Band is about to throw some tunes our way.
My name is Anthony Bolt.
So you are the Rochester Community Band Director?
Yes, and I also direct bands out at Cass and Manorville High School.
Okay,
so
you're all over.
Yeah, a little bit, yep.
Can you share a little bit about how many people are in the Rochester Community Band and like what are the demographics, all that good stuff?
Yep, so we have been around for about 25 years, and there's a great group of just various ages. So our probably youngest is probably young as 14, and I know we've 14. Had a couple, so
that's awesome.
And so we've had some students from SEMIO join us this summer, the Southeastern Minnesota Youth Orchestras, and I know we've had members 80 plus, and sometimes those members don't give us their specific ages, but we know that we have a few of those people as well. The group averages about 60 to 65 members, and it's come when you can. This summer, after COVID, we've had just a lot of people want to play and get together again, and so we've had a great number show up this summer.
Do you typically do the 125 Live parking lot?
We've had a beautiful partnership with 125 Live over the years where we've been able to do concerts inside. We've kind of outgrown their indoor space a little bit, both as a band and the audiences that we were getting here. A lot of our audience members are members also of 125 Live, and
awesome.
So that's been a great partnership.
So are the events like free?
Yes, they're free this summer. Yeah, they're free this summer.
There's no excuse.
Yep.
Sounds crazy tonight. Maybe I should call and say, told you I'd be right. Wondering how long it was before you realized the biggest mistake of your life.
So we're back talking with the Director of Public Health at Olmsted County Health Services, Graham Briggs. This past week, the county recommended masking indoors, even for those already vaccinated, as the county reached a level of substantial community transmission. Welcome back, Graham.
Thanks for having me.
So we were talking about what it means for there to be a substantial level of community transmission at the top of the half hour here, and the recommendations that the county has made. Do you think that we're going to be seeing a mandate from city leadership coming down the pipe anytime soon?
Well, I can't speak for elected officials and city or county leadership that ultimately make those decisions. What I can say is that we're following the CDC guidelines. The state of Minnesota, through the Minnesota Department of Health, is supporting those, and we in Olmsted County support those recommendations as well. And so what that calls for, based on the amount of transmission that we've got right now in the community, is for people to wear masks when they're in indoor congregate settings. We don't have to actually even have the discussion, though, about mask mandates if we're all coming together as a community and voluntarily wearing masks if we go indoors, because ultimately this goes back to, we're not protecting ourselves with masks. We're all protecting each other to protect those most vulnerable, whether it's somebody that's had a bone marrow transplant or a child that's 10 years old that can't get vaccine. Wearing masks is really something that brings the community together and protects us all. So I'd like to avoid the mandate, question it all and help push this transmission back down so that we don't even have to wear masks anymore.
So we talked a little bit about the Delta variant, and that being, that's arrived, that's here in the county, that's the cases that we're seeing. There's some speculation, some thinking that this recent surge is kind of a bubble, and soon infections will lower, with minimal intervention. Specifically here in Rochester, when will we know that this is the start of a real sort of trend upward?
Well, the data that we're seeing so far, we've seen a turn up just. It's within the last week or 10 days that we've really started to see it turn up. We've seen this in other places around the country. It started happening a little bit before us, but we are in a bit of a unique situation. I think it's a good problem, though, to have, in that we've got one of the higher vaccination uptake rates in the nation. We look a lot more similar to the state of Vermont, which is leading the nation in vaccination uptake, than we do, like Missouri or Arkansas, where they're seeing really difficult waves go through their communities. And so I think there's some optimism here that we'll see some transmission blunted because we do have a high percentage of the population vaccinated. But it's clear now that Delta variant is moving through Minnesota and through our communities here locally. So it really is a question of how many people get out, get vaccinated, get themselves protected, how many people are willing to wear masks at this point, and how we can come together as a community to push this transmission back down again, push it back out of this community.
Sure. We know that this is a vaccine preventable disease. As you're sort of thinking about those recommendations around masking for those that are vaccinated, what messages would you have for those folks that are still kind of on the fence considering getting vaccinated?
I think the biggest message that I can give the public right now is that if you're still thinking about vaccine or you're kind of on the fence, now is the time to call your doctor, have that discussion with your physician, who hopefully you trust. If you don't have a physician, it's time to go find one and really think seriously about whether it's time for you to get vaccinated. If it was up to me and I could just ask everybody, I would say now is the time. Go make that appointment, get vaccinated, because that is the thing that's going to prevent people from getting seriously ill and potentially dying from this. Unfortunately, if you need a little bit of context, it's not just the older population that's dying. There's 30-year-olds dying and healthy people dying in places in Louisiana and Mississippi and places like that are seeing sustained transmission and a really difficult phase here. So that would be the one thing that if I could recommend to the public, I would, is go get your vaccine now.
Thank you. So, of course, we're used to this over this last year and change of having to do this risk calculus, each and every one of us, every day as we're sort of moving about our lives. And for everyone, there's going to be some sort of different factor at play. How would you advise individual community members to assess the risks and make those personal decisions about how to proceed just in the next few weeks as we kind of get through this surge here?
Well, I think it's good that you call it risk calculus, because that's really what this is, and every family is going to vary a little bit. For a family that does have that's visiting Olmsted County because if a loved one is at Mayo and they've got an immune compromising situation where they're on chemotherapy, so their immune system isn't working quite right, those families are going to have a very different equation or a very different viewpoint on what's acceptable risk, as opposed to a family that might have kids that are too young to get vaccinated. Technically, the recommendation is still going to be that we should really limit exposure then and help protect those kids. We do know that children are at a much lower risk, though, for severe infection. So some families might feel a little bit more comfortable taking that risk. At the same time, though, you want to weigh this realistically, knowing that for those parents around the country that have lost children due to COVID-19, they'll tell you that risk is there. And so it's It's really a risk tolerance, argument that you need to go through in your head as a member of this community and a member of a family and someone that's making decisions about whether you have your groceries ordered in or go to happy hour with some friends. That's going to vary from person to person. And I think the important thing then is that people are thinking about that as they make decisions and doing things that they're comfortable with.
Great. Well, thank you so much, Graham. We'll be following the latest recommendations and guidance from the county closely and any updates that you have, but thank you for joining us today. And thank you for joining us. Be well and stay safe, and we will see you next time on Our Town, the show about Rochester.
Funding for this program is provided in part by the Minnesota Arts and Cultural Heritage Fund and the citizens of Minnesota.